Now, the Eastern Cape Health Department slamming acts of violence and intimidation allegedly committed by some members affiliated with Nahawu. If you just tuned in, we need to remind you of exactly what they are demanding. They want a 10% wage increase. Now that Nahawu action has spread around the country. Patients being turned away from some healthcare facilities in various provinces, including the Eastern Cape. Well, let's get the reaction there. And I'm now joined by Dr. Rolene Wagner, head of Eastern Cape Health Department. Hello to you, Dr. Wagner. I appreciate your time this afternoon. And I imagine that turning away patients is incredibly dangerous with what is happening with this Nahawu strike. What's your reaction?
Good afternoon, Gareth. Thank you for having me. The sector has a position that health is an essential service, and therefore any strike action is unprotected. What has transpired across the week has been escalating, and we've been really concerned because obviously it does affect our capability to provide essential services and can have a potential impact on patient well-being and outcomes.
Because we're hearing
so we have engaged.
Go ahead. Sorry, please go ahead. Forgive me for interrupting you. Continue.
Not a problem. So what we've done is we have several interventions in place. We have followed the administrative route to inform Nahawu that we've issued ultimatums. We've also gone before the courts because we are concerned about the intimidation. We have had entrances blocked, tires being burned, crowds moving facilities. We've had crowds pulling people out of the ward. Now, the other four unions have not been supporting the strike. And so as much as Nahawu has a right or wants to claim the right of being able to strike, similarly, others have a right to work. And so it's untenable. It's not acceptable that other employees are blocked from performing their duties. And so we have gone to the courts, and I've just been informed now that we've been granted an order. And that order assists us in protecting our institutions and ensuring that these incidents of escalation can now actually be called to a halt. And SAPS will work with us to enforce the order.
So I
At the
imagine
same time, we've made...
That's very good news. Forgive me,
Yes.
Doctor. I just want to make sure, just on the patient's perspective, that news you just received now, does that mean that patients are going to be allowed by Nahawu, it's a strange comment to even have to talk about, are going to be allowed back in to get health care with the support of SAPS?
In parallel with us going to the courts to try and get an order which grants us permission to ensure that our patients and our staff and our assets are safe, we did engage with Nahawu this morning at 9 o'clock. And the Nahawu, the office bearers of Nahawu share our concerns. They also do not want that there are acts of intimidation or that services, essential services to our communities are affected. And in view of us having the shared value of wanting to provide essential services, we did discuss how we can de-escalate the current situation. Our discussion did not talk or deliberate on our different positions around what is a protected, whether strike is protected or not. So in other words, the legal proceedings will still continue. Similarly, we did not discuss the merits of the fact that our position is that it's an essential service and therefore they cannot strike, whereas their belief is different to ours. So we did not deliberate on that. The main purpose of us getting together was to say, as a department, we are concerned around the escalation. We are concerned that at an institution today, someone had a weapon and was assaulting our staff. That is just not acceptable. It's not acceptable that a service or a facility cannot be operational. So we have agreement that we want our facilities to be operational. And we've agreed that there'll be discussions at a local level to ensure that we are able to find workable ways to provide the services and have our services operational.
So what is the timeline to when we're going to start seeing your staff being allowed back in and back out? I'm hearing at other hospitals, some staff aren't even allowed out. And when could we start seeing patients getting back in, getting the care that they need?
So following our meeting today, we immediately held a meeting with our management across the province, and we shared with them the court order, as well as sharing with them the agreements that we reached with Nahawu, the discussions and the outcomes of those discussions. All of these managers now have been directed to engage with organized labor at a local level to discuss how they find these workable ways to ensure that services are continued, to ensure that intimidation does not happen. to ensure that entrances are not going to be blocked and that people are not going to be prevented from coming online to provide services. And then, of course, within the institutions, what are those critical areas that are sacrosanct? We use the term sacrosanct, like your trauma, casualty, emergency areas, our theaters, our ICUs, etc. So these discussions are happening now as I speak. The next shift is coming on at 7 o'clock. So Nahau is following their processes of obtaining a mandate, engaging their regional structures so that the regional structures will engage with our facilities. Notwithstanding that, our facilities across the last 3 days have been meeting with organized labor at a local level and been trying to find workable solutions. I think the discussion with the provincial leadership now embeds that, and it gives everybody comfort that we want to work together to ensure that our services are operational.
Doctor, I'm going to say goodbye to you in just a moment. Just before I do, though, are you under the impression at all that any patients' lives have been put in immediate danger as a result of this strike action?
So when you close a facility like a community health center, and that community healthcare center provides maternity services, closing that structure means that the burden is now shifted to the nearest hospital. So in Nelson Mandela Bay, as an example, if the community healthcare centers were closed, Dora and Ginza immediately had to absorb it. Now, if at Dora and Ginza we're providing theatre services, but it's only one theatre and not our full capability, then that can contribute to creating a backlog. We've had to airlift patients out using aeromedical services where our EMS entrances were blocked. So it does put a strain and it does increase risk at our facilities. However, everybody has been working really hard to unblock those blockages. SAPs have been called upon to assist our institutions to clear entrances, etc. And over and above that, the managers and other health professionals have really stepped into those areas that have not been covered. So hard hit, for example, would be our kitchens, our laundry areas, our ground staff, our cleaning services, and then critical areas in the wards. We are now hopeful that our engagements will be constructive engagements. It does not stop the administrative processes because we believe this is unprotected action. And so the administrative processes and legal processes will continue. In practical terms, though, we want to agree with the strikers that there are these areas that are critical to function because they're critical to patient care.
And Doctor, I'm going to say thank you very much. Indeed, I think you've given us a wonderful perspective of how it's being handled. It sounds like dialogue is open with the main focus, Dr. Wagner, what I'm hearing is to get the care back for the patients as quickly as possible. I thank you very much. I wish you and your team the very best in navigating what is a very tricky negotiation when it comes to organized labor. Dr. Rolene Wagner is head of the Eastern Cape Health Department. I thank her for her time.